I have a deep love for this country. So from the moment I went to Hopkins, it was with the intention to come back to Bangladesh and work here as a public health professional. There's an unconscionable thing taking place out here. That is, mothers and children are dying needlessly. We have one right here who died.
You're looking at roughly 11,000 mothers dying from pregnancy-related causes, and well over 250,000 infants who die in this country every year from likely poor nutrition. We're trying to look at whether or not improving the nutritional status of women and infants, particularly through vitamin A or beta-carotene, will prevent some of those deaths from occurring. If we find that this intervention even reduces 20% of those deaths, we'd be looking at saving about 50,000 infant lives per year in this country. We've got to get the science right, because in countries like Bangladesh, where resources are scarce, if we make recommendations, we want to make recommendations that are sound, that are based on scientific evidence. And so our job here is to get it right. Once we get it right, it can move mountains.
This is the first step in that chain. Asking a question, finding the answers, developing a program, and then improving lives. At Hopkins, the thing that we learn to be is internationalists. We become scientists for the world.
Welcome, welcome. My name is Mike Ward, and I'm the Associate Dean for Student Affairs. I was going to say I've got background music too. All right. No, I don't have any theme music, but welcome. Welcome to the Admitted Student Visitor Day. And we're so glad you're here on this rainy day. But it's a great day to be inside, as Dean Burke pointed out to me a little bit earlier. I have a couple of housekeeping things that I want to do just before I really get into the meat of the day. For those of you who, this room carries sound very well, so if you have a cell phone or something on ring, if you could just turn it to vibrate, we'd really appreciate that. I always keep mine that way. So, all right, so after the housekeeping item, you know, you look around to your left and you look around to your right, and you see a lot of people who have gone through a very rigorous admissions process. Graduate admissions is not the easiest thing to do, and you're sitting right now in a leading school of public health where there are a lot of challenges and a lot of things that you have done to get here. So I want to take a second to congratulate you, but I want you to congratulate each other, because a lot of this interaction here is about peers and working with each other in teams. So congratulations. I'm going to talk to you a little bit about the university, a little bit about what we have planned for you today, and then to turn it over to some of my colleagues. But first, a little bit about the university. It opened in 1876, and Johns Hopkins was a Quaker merchant who donated at the time $7 million, which now might seem like not as much money as it was back then, but really was the founding, the cornerstone to this university. And what is this place about? You know, what is this university about? Daniel Coit Gilman, who was the first president, when his installation address, started to talk about what are we here to do? What are we here to do? And it's encourage research, advancement of individual scholars, and really working towards excellence in sciences that they pursue. But what is the aim of all that? Improving society. So, in essence, the mission of the university is knowledge for the world. As you can see, we have 20,000 students, part-time and full-time. I think the part-time ranks have grown throughout the university, while our numbers are pretty consistently in the full-time ranks. But we have 3 campuses in this Baltimore area. And, you know, as you look at it, if you go from here to D.C., there are various other small operations that you'll see as a part of Hopkins. And that leads me to one thing, that in this state and in this region, we're a major economic force, because if you look at the university, you look at the hospital, we're one of the state's largest employers. beyond that, I would say one of the things that's really important to know that there are 9 different schools. The only area that I will say that is really missing from the equation is a law school. So there's the opportunity to take classes other places. There's the opportunity to just interact and collaborate with other schools and other disciplines. Let me just ask one quick question. I should have asked this at the start. How many of you, all of you admit it obviously, but how many of you decided I'm coming? All right, that's a little less than a quarter. All right, get them waving, get them waving. Okay, all right. All right, so now we see what our task is at hand. All right. So every dean has to bring up some history, something that, some historical piece, part of their discipline. I'll tell you, when I was a student in administrative, sciences and higher ed, one of the things that came up about Hopkins, this is long before I came here, was that it was designed in the German model. And some of you might say, okay, so what? Here's the so what to it. Many of the colleges and universities in America are based on a British model, more of a residency model. The German model is very different in that it really has a focus on studying with the scholar, finding a leading researcher, finding a scholar. And I think what you'll see today is that we have a lot of passionate scholars, and that mission and that primary point is still relevant. So let me frame a little bit for the day for you today. As you're visiting us, I would urge you to ask the questions you need answers to. What do alums do? What are some things, how can I connect? How can I fit in here? Whatever those questions are, I would really urge you to ask those questions and get a sense of what you need to know about whether this is a good fit for you. Check out a lecture. You have that opportunity. We'll have the Bloomberg series, which I'll talk about in a few seconds. Learn the ins and outs of your department or program. You'll have some time with your department or program. I said we had 20,000. Every time I look at that number, I'm truly amazed. This is the second school I've worked at in this university, and it never feels that large. Prior to coming to Hopkins, I only worked at very small schools, with the exception of the place I went to graduate school. I've never experienced the large numbers, but I tell you, your department home is a much smaller place. Those of you in biostatistics or HBS or even some of the larger departments find groups of interest, of similar interests, and it doesn't feel that way. So check out the ins and outs of your department a little bit later today, and you'll get that sense. Hear about our services and resources that are available. Just like the student activities that I'm talking about in a second, they're really tailored towards public health students. So we don't have, so for instance, our registrar is right here, our admissions office is right here, financial aid is right here. So you're not going to someone on another campus of the university. Beyond that, I would urge you to take a tour and just get a sense of what's going on around you. As you could see from that video, there's an awful lot of passion about the work that is done here. As the commercials say, we live and breathe this stuff, and I think it's really true. If you go past the scratch and sniff test, I think you're going to find a lot of passion. Speaking of passion, I think this is the part that I think most who come to visit really enjoy. These are the seminar series. I mean, you can read the descriptions yourself, and they're in your agenda. And Dean Terrett is actually kind enough to join us this morning for this section. But I think this will be an exciting time. The unfortunate piece, you'll only be able to choose one of these. And I think you will find that at this school. Often with lunchtime series, there are often so many things to do, so many different angles in public health, that you may not have the time to do all the things you may want to do. So choose wisely. Let me move on here to just some highlights. The other day when I was, or last week when I was, said, okay, get your PowerPoint together, Mike, what are you going to do here? What are you going to talk about? I just looked on our website and I looked at some of the things that are going on here. Just some of the things that are just noteworthy right now. As you can see, Dr. Hochgrave, who's the chair of Health, Behavior, and Society, was appointed to the Presidential Advisory Committee. Dr. Black got a global award for outstanding contribution to global child health. Dr. Griffin, you can see, was named to the Governing Council of the National Academy of Sciences. These are the types of things that happen here amongst this leadership group. These are the types of people you'll be able to work with and have some interactions with. beyond that, I would say as you look around and we look around at what's going on a daily basis, you'll see faculty, staff, students actively engaged in health policy and health-related work throughout the communities here and on a national level, because D.C. is right down the road. And I tell this story, and sometimes people joke. I joke about this, like, oh my goodness, you need to meet more of our MPH students. But I volunteer for my delegate where I live. And I can tell you, I've met probably more MPH students doing the parades, doing different things, whether it's in Annapolis or other places, than I sometimes meet here. And that's not just MPH students. As I think about it, there are a variety of health policy management students, a variety of students from all the different disciplines. So this is a very engaged place, and some great things are happening. I referenced a little earlier that we have a lot of programs and services that are tailored to our students. We have about 40 student organizations in the school, and you can see these are student organizations in this school. So you're not going to another campus, it's not a part of another group, or you're not going to feel like you're on the outside, so to speak. But it's a great group. It's a great group of activities, great group of experiences. Often they're groups that are involved in different types of functions throughout the community. So I think it's very helpful for just to know as some resources available. And I'm getting the signal that it is time, and unfortunately I left a couple credentials off here. I didn't see that. You can see some of the things our alums are doing, just different faces throughout the states and throughout the world. We have an influence. And I'm going to move right along to our next speaker, who's going to tell you, Dr. Burke is going to tell you a little bit about the school itself and welcome you as well. And a little bit about Dr. Burke. He was the, and I feel kind of odd because he's saying, oh, he's looking up here. Tom has served as a Deputy Commissioner for Health in New Jersey. He's also, probably the biggest thing I would say about Tom Burke is that he's a 4-time recipient of the Golden Apple Award for Outstanding Teaching. And some of you may sit in your chair and say, oh, okay, that's okay. But how is it decided? Students sitting in chairs, just like the chairs you're sitting in, say, here's what we like, here's what we feel is outstanding, here's what's exciting. So to be voted that way by students on 4 different occasions is really outstanding, because as Dean of Students, I can tell you, we've got a really thinking group, we've got a really progressive group, and are going to push the agenda. So the last thing I'll say about Tom is he's a guy that you'll see heading on the subway. I remember one day I catch him on the subway, he's going to City Hall, or going to D.C., or going other places to influence policy. So with no further ado, I'd like to welcome my colleague to the podium, Tom Burke.
Huh? Okay, that's me. So bear with me a little bit. I used to give the scholarly lecture, and then I became an associate dean. So now I get to do a relatively quick introduction and to talk a little bit about the school. And so this is my first time. First of all, great welcome to the Hop. All right, it's an amazing place, and you got in. All right, so because I have to tell you, I didn't. All right, it's true. It's true. There's lots of good schools out there. But actually, when I discovered public health, Hopkins was a school that primarily was focused, the MPH degree, which I was interested in. I was teaching school in Jersey City, New Jersey, in an alternate high school where kids were, yes. Okay, how many of you are from New Jersey? That's amazing. There are some years nobody gets in. That's great. So you can tell I'm not from around here. I got this accent, and if we get together, I'll really have an accent, because when you go home, then all of a sudden you turn into Sonny Soprano or something, and you start asking all these questions, So anyhow, yeah, I was interested in Hopkins because and this is actually a true story. Hopkins is incredibly special to me, and it's right that I'm here, and it's just amazing to be on the faculty. And you're actually my 20th cohort. I've been here for 20 years. I did really cool things beforehand. You know, I was Deputy Commissioner of Health in New Jersey, and I have had a blast in public health. It's just an amazing career. But my ties to Hopkins are truly heartfelt, and it's because when I was a kid, I was born with this like whopping hole in my heart. And I grew up in Jersey City, so some of you might say, he should be interested in environmental health, and that's absolutely right. But in '65, open heart surgery was pretty new, and there weren't many places that could do it. There was actually one in New Jersey, I think, Deborah, down in southern Jersey. And I was really lucky to have a cardiologist who trained at Hopkins, and I got sent down here. And it took 2 years on the waiting list to have the surgery. But, and I remember asking, at Hopkins when you go over, so if you go to student health and you have like an interesting thing going on with you, 1 million young people in white coats come in and listen to your heart. Now, they never explained to me as a teaching hospital. I thought I needed like 5,000 doctors to listen to my heart. I'm terrified over there. And so anyhow, things worked out, and I had heart surgery, and they fixed me up. And I had asked them when they were doing the diagnosis, I said, well, what if I don't have the surgery? And they said, well, you'll die. And I said, okay, let's schedule. And they did. But so the big revelation about public health, which I didn't realize at the time, so I'm in the recovery room, the ICU, and I have this big respirator on. And they didn't do pain management too good with young kids, and my chest is hurting because they just used a Volkswagen jack to open it up, right, and repaired my heart. And I realized prevention is where it's at. The surgery is great. But if we're going to really make changes in public health, it's about understanding what the causes are of these diseases and conditions, and prevention is where it's at. And so prevention is where it's at here, too. So I became an epidemiologist, not a famous heart surgeon. But anyhow, welcome to the Hop, and I really didn't get in. So I'm speaking on behalf of the real dean. I'm the Tom dean, the practice dean, Mike Clagg. And I noticed Mike was actually not born in 2005. He's much more mature than that, but he welcomes you also. So some of this lecture is mine, and some of it isn't, you can tell. So right now you're thinking, there's this great sense of satisfaction when you get into a great school, right? You get the fat envelope, not the skinny one. Believe me, I've gotten the skinny ones too. So you get in and you're feeling really great. But you're good, so you have a lot of decisions to make. So how do you make that decision? All right. Well, you have a lot of opportunity here. It's just amazing, and you can see the kind of things that contribute to that opportunity. So how many of you have seen Napoleon Dynamite? All right. Vote for Pedro? All right, I love Napoleon. And me and Dean Terrett actually, we're kind of like the Napoleon and Pedro of the school. But do you remember Pedro's campaign speech? Now, I can do the Napoleon dance, so don't get me started. But do you remember his slogan when he gets up? He's terrified. He's just like this. He gets up to the microphone and he says, if you vote for me, anybody remember? All your wildest dreams will come true. So I'm not saying anything about Hopkins, but it's a cool place. So you've heard, this is a great picture of William Welch, the first dean of the school. There's actually a really cool statue of him sitting on a horse right outside across from here. He looked a little more robust in the statue than he does in this fine photograph. Hair loss is an issue for faculty sometimes. It's a stressful job. But he established this new model that actually we used to be the School of Hygiene. Hygiene, that was kind of weird to explain to my mom, and public health. And we renamed it and rededicated it in 2004. Obviously, we do a lot here, research, mentorship, and teaching. And I have to tell you, practice. We're out there, outside the doors, changing the world. And so the mission is about the discovery and application, all right, and the improvement of health and prevention of disease. So there's that prevention word that I really like. You've heard from Mike some of the things. There's lots of people here. All right, new students and continuing students from all over the world, faculty. I'm here basically because I love teaching, and the students are great. The faculty aren't bad too. So I have to show you this. I don't see a big balloon in New Jersey, but actually I'm actually doing some environmental research in New Jersey because, believe it or not, there's been incredible progress in reducing exposures to chemicals in New Jersey that we think are saving lives a million at a time. So you got a lot of comparisons to think about, and so I'm gonna walk a little bit here. Can you hear me with this now? This one working? Okay, good. So this is, how do you figure out what school is like the best? Well, one way is to look at, okay. So I have a way, all right? So what I do is, like, I check out the hoodies, go to the bookstore, and buy a hoodie and wear it this weekend. And just like feel Hopkins. And we are, this is not my natural state with this tie. Okay, so let's do science here. These are all great schools. Grants and contracts were a little greater, actually a lot greater. And I'm not bragging. We have 10 academic departments. There's so many of you and interested in different degrees. I don't have to tell you that. You've read the catalog. But where else can you get this wonderful combination of people who are really at the front lines of public policy? And this is a really interesting time as the whole nation is grappling with what the heck is going to happen to the healthcare system, and is our system of negotiating and moving forward in public policy falling apart with the stalemates that we see there. But epidemiology, environmental health sciences, I actually work very closely with many of these departments, and it's just amazing. But I actually have to tell you that the true direction of public health is very transdisciplinary, and this is the place also to get a sense of how these disciplines come together to make change. We have, as the Dean of Practice, I can say we have faculty engaged in practice and service. It's fun to work here and teach here, but I'm so privileged to have an ability to work in Washington, to be on the EPA Science Advisory Board, to meet with the administrator and comment on the budgets that the President puts forward for various scientific initiatives, the National Academy of Sciences, on the real tough public health issues facing the world. So, you know, this global climate change thing is heating up, right? And there's lots of concern about credibility. Now, I wasn't in the first round when everybody got the Nobel Prize, but now that it's lasting up, I get a call from the State Department, could I please coordinate the risk assessment for the International Panel on Climate Control? Well, let me think about that one. But those are examples of the kind of things, and as a student, you get to work with the faculty on those front lines. We have opportunities, and you'll hear about SOURCE later on in the day, to work in the East Baltimore community, to work with our partner institutions throughout the community. And it's amazing. So you have the many legs of kind of the stool. You have the core sciences, the public health sciences. You have the applied side of things. You have research and new knowledge. You have international health. You have local community health. You have getting outside the walls. And what should you expect, really, when you get in here? Well, I'd like to talk, you know, Letterman always talks about the top 10, and I'm going to give you top 10 reasons, right? And they're not funny. They're for real, and they're from the heart. The first reason to come to the school is your fellow students. There is a family of Hopkins students who have been through this institution since its founding, that are leading agencies, that are around the world, that if you wear that hoodie, even if it's 30 years old, and you're wearing it in Bangladesh, somebody will know that there's an S on the end of the John there, because they went here. And the fellow students are the greatest resource, and that is why I think faculty love to be here. We learn so much. You're hard to teach. You challenge the heck out of us. It's not easy to stand here and then say, any questions? And then, oh, God, they have questions that you never thought of. So, but you also get the perspective from the edge. Well, what do I mean by that? Well, I'm proud to say we are on the edge of science. Right? Read the newspaper. We're in there all the time. Read our webpage. We are pushing the science forward, whether it's on public policy or new ideas from molecular biology. Right? We're also pushing practice. Our students are leaders. And then there's this thing, all right? So I can say, well, all right, I was able to achieve things academically because I tested well. And to some degree, you're here because you take tests pretty well. But there's a lot more to that than that, to really being successful in public health and being a leader and making change. And one of the things that has been most important to me are my mentors. Right? Now, I don't care how old you are or what you've achieved or whether you're at the beginning of your career, having the right mentors is everything. All right? And I say, like, who are you going to call? Well, that's true. And I have to tell you, when I was making really tough decisions, like I closed the Jersey beaches in July one year, 129 miles of the Jersey Shore, because there was a huge wash-up of bad stuff, medical waste, poop. All kinds of things can happen out there in the ocean when you have illegal dumping. And we didn't know what the risks would be. Well, it's July and it's Jaws. I mean, you think Jaws was an interesting movie. Well, in the 80s, the Jersey Shore was a lot more interesting than Jaws. There weren't shark bites, there were needle sticks. Who are you going to call? Who are you going to talk to before you go in and brief the governor about this and make the public health call that you know is going to have huge economic and political consequences? That may have cost that governor the vice presidency that summer. It's that high level. And those are the kind of decisions we're involved in. So I would recommend, and you'll get, so if you guys, like, I know a lot of people didn't raise their hand about who's coming here, but if you come here at orientation, I'll talk to you about mentors and getting 4 mentors and how important. Because as I worked my way through the legislature in New Jersey as a appointed official, and as I worked my way as a junior faculty member to understand Hopkins and how to succeed in this place, my mentors were the ones that led the way for me. So, and this is a place where you have all kinds of great mentors. So I hope you get a chance to meet Dr. Edith Schoenrich, who is my wonderful mentor, who is the historian of the school, and we had a 90th birthday celebration for her this year. And then my management mentor, Don Steinwalks, who was the chair of my department. And so we had this party one day, and I'm trying to be a serious scientist, and he said, Tom, the staff gave me this grass skirt and this costume, and they want me to wear it. Would you do it with me? So I said, what the heck? So I went down there, we had a party, I wore coconuts, and that guy owes me. So there's lots of ways to get a mentor. All right? Now, the academic offerings. This is a good school. You can take great courses. There's way too many of them, and you'll go crazy trying to figure it out. And you'll register for too many credits. But building your toolbox, all right? Some of the degrees, like the MPH, are general degrees. And it's important to focus on what's going to define you. Right? I've interviewed so many folks in the public health practice arena. I'm on a search committee right now. And Mike said he saw me on the subway. I've been on the search committee for the health commissioner for the city of Baltimore. Right? I want to know what those candidates are bringing, what toolbox they have. Defining your toolbox and matching the kinds of things that you're good at and you want to specialize in with the academic offerings is really important, and you can do that here. Opportunities for practice and policy. All right? I have to tell you, I've lived in other areas. I went to the University of Texas. I've been in other areas of the country. There's something great about the lens we have here, being 35 miles away from the capital, and being able to participate and observe a little bit outside the Beltway, but almost inside the Beltway, how the policy process unfolds. And at the same time, to work with faculty who are very much involved with all the agencies and the political leaders in trying to shape public health policy. I probably don't have to say much about the research. We have multidisciplinary research that spans from the very molecular level to the community, even the international level, to now the global level on issues like climate change. And that's there. And you get to see the front lines. So I do amazing things because of students that I've worked with, because of my work. So when Katrina happened, remember this they called it the toxic gumbo. Well, I have to tell you, like when bad stuff happens that smells, Jersey beaches, sludge, things like that, I tend to be an expert in that. So I actually went down and worked for FEMA and the government to try and understand the exposures from the toxic gumbo, and was down there right after the hurricane. And then later on, unfortunately, another tragedy was the formaldehyde from the trailers and what the health effects would be of people who were living in the trails way longer than we ever wanted them to be, 2.5 years. Students were involved in that. Here in the city, worked on the closure of Swan Park from arsenic contamination, been working with the Department of Agriculture on the food supply. Food is a huge issue that we really are just waking up to in this country, whether it be from the contamination side or the obesity side. There's tremendous public health challenges there. This is a pretty cool one because not a lot of people know that under the nicest neighborhood in Washington, D.C., there's World War I chemical weapons buried around American University. And they're trying to figure that out, so they gave me a call. And then there's this, I don't know if you can see that, but that's a mountain of poo from, I have to mention that because I'm the world's biosolids experts too. And like one of the tricks of public health is keeping poop away from people. But because of all those beach closures at the Jersey Shore, I worked to ban ocean dumping in the 80s. And it was great. We don't dump your poo in the ocean anymore. So guess where it goes? Anybody know? Think about it. Well, now the bright idea is to use that as fertilizer, so it's going to farms. With all the stuff that's inside of it, including a fair amount of Prozac and things like that. So, another reason. You will look cool in a Hopkins hoodie. There's no doubt about it. And it will feel good. And then there's life in Baltimore. People say, Baltimore, wow, this is... No, wait a minute, Tom. I just saw it out there. It's a gray day. I'm sorry. It's always beautiful here except for today. We got no snow this winter. If you're from up north and you're hassled with the snow, come here, throw away your winter coat. It's amazing. Just don't go outside. Baltimore's pretty cool. There's city life. There's the challenges of city life. That's what public health is really all about. So we have disparities, we have issues, and you'll hear about those things. But it's actually a great place. Right now, I lived in Philadelphia. I lived in Houston. I'm from Jersey, so I hung out in New York City. I know big city life. This has all the good parts, some of the hassles, but it's an amazing place to live, really. There's great recreation nearby. If you want to get to the bay, you want to get to the mountains, it's close. Like I'm a Philadelphia Eagles fan, but there are some people who like the Ravens, and we're an NFL city. We have amazing Johns Hopkins lacrosse. Food's okay. Big portions here, though. We got to work on that. It's a public health issue. And then there's the people. I'm from Jersey. Like people in New Jersey are like, you know, how you doing? But here, it's a nicer place, right? And we're actually. Did I mention we're a pretty good school? Consistently rated #1 school of public health. Now, I'm not, numbers aren't everything, but we're consistently #1. So, and I want to finish with why, getting back to Pedro and Napoleon, my inspirational leaders and mentors. Maybe. And I have seen this. I have never had a student in 20 years. And today's a pretty cool day, so I do welcome to you. And this afternoon, a final defense for a student I've worked with for years who's finishing and defending her dissertation on water quality. And it's just amazing. And I've never, in all the students I've worked with, had anyone who said to me, I should have gone to Harvard. I should have gone to Emory. I should have gone to Michigan. There are times when they say that during the third quarter, when there's papers due, and they say, this quarter system is driving me crazy, Tom. I haven't eaten in 3 days, or I haven't stopped eating in 3 days, or I haven't slept. But maybe, just maybe, as has happened to me, and I have to say this, it's been a wild ride, but maybe all your wildest dreams will come true, millions at a time here. So welcome to the Hop. Thank you.
Ward and Dean Burke for their time here with us. I would first of all like to personally welcome you all. My name is Leslie Vink. I'm the Director of Recruitment and Communications here in Admissions Services. I know all your names. It's so nice to see some faces and some also from other familiar faces from when I was recruiting. But congratulations. We're thrilled to have you. And we really do hope that this event does answer all those questions for you. If you feel that you still have some questions remain, you're going to get a lot of information today. But you can always stop by our Student Affairs Suite and ask for an admissions representative, and we'd be happy to help you as well. I have the great pleasure of introducing our next presenter, Chuka Anude, a graduate of the MPH program here at the Bloomberg School and continuing Hopkins Sommer Scholar in the PhD program in our Department of Epidemiology. Prior to enrollment here, Chuka's resume was already 14 pages long, and he had amassed more than 10 years of experience in 4 different countries, concentrating on public health program management and field research, primarily in HIV and AIDS. He was the chief of party and the country director of a U.S. government-funded initiative in Guyana to combat the country's HIV/AIDS epidemic. He designed treatment guidelines and drug adherence strategies, trained over 250 healthcare providers in HIV care and support, and conducted research in the treatment of HIV/TB co-infection. Chuka's dedication and leadership in the field of public health are infectious, and we are just delighted to have him here to present with you today. But before we hear from Chuka, here's a look at his story.
Leadership is everything. Leadership means influence, the ability to influence people in the right direction, the ability to influence people to make things happen. In Guyana, I was leading the largest U.S. government HIV treatment program in the English-speaking Caribbean. We had set up the first CD4 lab in the country. We had trained over 300 healthcare professionals, and we had put a lot of people in Guyana on HIV treatment. The program was doing well. We had met all our targets, but I wanted to do more. I decided to go back to school. I came here to Johns Hopkins in 2006 because I wanted to acquire some advanced skills to be a great global public health leader. And our summer has been a great inspiration. One thing I've learned from him is how to lead, mobilize people, and make health policy. It's all about leadership, leadership, and leadership. When I end my PhD, I want to go back to Africa and work at the continental level, at national level, with ministries of health, with NGOs, to develop programs to strengthen health systems, to deliver the best package of care in a sustainable manner to the vulnerable people who need it most. Clinical medicine is good, clinical medicine is wonderful, but you're saving one life at a time, one life at a time, one life at a time. For public health, you save millions of lives at a time. When I go back to Africa, I'm planning to save millions of lives. Good morning, everybody, and welcome to Johns Hopkins. It's great to see all of you this morning, and you all look great. My name is Chuka. I finished my MPH here in 2006, and I decided I didn't have enough, so I stayed back. I'm a PhD student now, and I hope to finish by August this year. First of all, congratulations on getting admitted to this school. This is a great school, and it's great to have all of you and to be part of the orientation for admitted students. I'm sure you're going to learn a lot today, a lot about the school, a lot about yourself, and a lot about what you want to do in your life and how you want to affect your own generation for good. I have a very short presentation. Okay. So I will just share with you some of my experiences. Just like Professor Buck was saying, I was admitted to 2 other schools of public health. I actually got scholarship. One of the schools is in London. I won't mention their names. The other one is in Boston. And I actually got scholarship to attend the one in Boston. And I decided to come here. And I've been here since 2006, and I don't have one single regret for coming to Johns Hopkins. This is the best place to be. And I'll share some things with you. First of all, I think Tom Buck just shared this with you. This is U.S. News and World Report. Johns Hopkins has been ranked the #1 school of public health forever. And We've maintained this consistently over the years, not just because it's just, ranking and so on, but because of the quality of the students, the quality of the faculty, and the quality of the programs here. So if you're coming here, you're coming to the #1 school of public health. And not just the #1 school of public health, it's the school of public health that develops leaders, like I was just talking about. One of the things that made me come here was when I was in Guyana, leading the program in Guyana. And we used to sit down with the Ministry of Health and with the Minister of Health to make decisions affecting the whole country. I was so surprised to notice that the USAID lady, Julia Rewinko, was a Hopkins graduate. The WHO person in the country, Enias Baganizi, was MPH, PhD from Hopkins. The UN/AIDS guy was also from Johns Hopkins. Of the 6 of us sitting, apart from myself and the Minister of Health, the other 4 people were from Johns Hopkins. And they were making a lot of sense to me. So I said, there must be something about Johns Hopkins that brings greatness out of people. So I decided to come to this place. So Johns Hopkins is #1, so you're coming to the #1 School of Public Health, and it doesn't get any better than being #1. So why do you want to come to Johns Hopkins? I'll just, talking from the perspective of a student. I'm going to share some personal, experiences with you just to help you to understand and also think through your reasons for wanting to come here. So some people come here because for them, this is just a preparation for a public health career. You want to save millions of lives at a time, and you want training to be a public health leader. Some people come here, post-residency. You finish your medical residency, and that's just not enough. You want to get some public health training. Others come here pre-residency. They want to get an MPH and MHS, a PhD, before they go and do their medical residency. Others come here as preparation for med school. Some come here as predoctoral students. And some people like myself come here as mid-career people. You've worked in public health for a couple of years, and you're not just satisfied with what you're doing. You're not just satisfied with the level of impact. You're doing well, but you want to do better. And I used to tell myself, if you want to have what you've never had before, you have to do what you've never done before. And that was why I resigned from my job, as lucrative, as ambitious, as good as my job was, just to come here and be a better person. Others also come here because they want to learn the business of medicine training. Our departments here, we have a Department of Health Policy and Management. Some of you may be coming here for the MPH, MBA program. Some people come here because, they are career public health physicians, or they want to pursue a career in public health. Others come here for AP and biostats training. This school is the best school in the world for you to do epidemiology and biostatistics. The first formal department of epidemiology in the world started at Johns Hopkins. The first formal biostatistics department in the world started at Johns Hopkins. And our past chair in biostatistics was the most cited biostatistician in the world in the past 10 years. So this is a great place to be if you want epidemiology and biostatistics training. Some people come here to get a brand name degree. Johns Hopkins is a good brand name degree. Some people don't even know why they are here. And then some people come here to get a smart spouse. Now, I was surprised when I came to this school and noticed that a lot of the faculty here were actually married to each other, and they met each other here in the School of Public Health. And there are so many of them, the chair of my department, the wife is also a professor here. And so the probability of your getting a smart child will increase from 0.5 to 1. I'm serious. The probability of getting a smart child will increase from 0.5 to 1 if you marry a smart spouse. And there's no better place to get a smart spouse than at Johns Hopkins. I'm not saying people come here to get smart spouses. But, if you marry a smart spouse and you're a smart person, the probability of your child being smart is 1. If you're a smart person and you marry a dumb spouse, then it's 0.5. So people come here for a variety of reasons. And, and the interesting thing about Johns Hopkins is that for whatever reason you want to come here, you can find a place here because this is a big school. Now, let me just talk to you from my own personal experience. I've been here since 2006, what I consider the Hopkins Edge. This is, this is the largest and still the oldest school of public health. We have about 2,000 students from 84 countries. So we have a lot of diversity. We have a large student body, and you can meet all kinds of people and learn from all kinds of students. We have the largest faculty of any school of public health in the world and the largest alumni body, almost 18,000 now. And then 1 in 6 public health graduates in the world actually come from Johns Hopkins. So you're more likely, if you're working in the field of public health, to meet somebody who also came from Johns Hopkins than anywhere else. Then, of course, this is ranked 1. And then we have global impact. We have projects in 91 countries from Afghanistan. Actually, Johns Hopkins is rebuilding the entire Afghanistan health system. So we have projects in 91 countries, South America, Africa, Southeast Asia, all over the globe. And we have 10 departments and 51 centers and institutes. Significantly, we have one of the only departments of mental health in any public health school anywhere in this country. And we receive about 25% of all federal funding. Think about it. We have 39 accredited schools of public health, and Johns Hopkins takes the chunk of 25%. The other 38 schools share the other 75%. This is an exciting place to be. It's fast-paced. Then the proximity to Washington, D.C. And you see, for me, this is one of the secret things about Johns Hopkins, our proximity to Washington, D.C. When I was an MPH student in 2006, 2007, because of my proximity to Washington, D.C., I was able to get a consultancy at the World Bank. And they asked me, look, if you weren't in Baltimore or in D.C., we wouldn't give this to you. And you know, in Washington, that's where you have all the big public health folks, USAID, Pan American Health Organization, all the USAID implementing partners, all the big guys are all in Washington, D.C. So being close to Washington, D.C., 45 minutes drive from Washington, D.C., is one of the good things about Johns Hopkins as well. And then there's a lot of emphasis on group work. You learn how to work with people, how to relate with people, how to work as a team here as well. Then I've talked about student diversity. Students are coming from as many as 84 countries. I have friends from Brazil, from Afghanistan, from Palestine, from Italy, from Australia. I've made friends from all over the world because you have students from virtually 84 countries of the world. So this is a great place to meet people and a great place to get to know about other people as well. And then we have many of courses. One of the problems I had when I came to do my MPH here in 2006, and you're going to have that problem, I bet you. You're expected to do about, 80, 90 credits to graduate from the MPH program. By the time I selected all the courses I wanted, I selected 166 because there were so many things you would like to do, and everything you want to do is available here. So it's so difficult picking the right courses because you have a diverse menu of courses to choose from. And then we have expert faculty, great alumni, some of the best people in public health. You can get anywhere in the world, you can find them here. Is it in cardiovascular disease, in HIV, in health policy, in epidemiology, in biostatistics, in whatever area, you'll find them here. And then there's a lot of emphasis on multidisciplinary training as well. Then there are other things about, Johns Hopkins that is good. We have lunchtime seminars, and people now know where the lunchtime seminars are happening, where the food is available so that they have their lunch there as well. And then we have International Clothing Day, we have Child Health Week, we have all kinds of organizations, Indian, China, African Public Health Network, all kinds of groups, Hanebeja, Student Assembly, and so on. So you can mix with other students, you can learn a lot from other people as well. And then I've talked about, the Washington, D.C. One of the greatest, apart from having all those big organizations in Washington, D.C., many of you are coming outside of Maryland and outside of Washington, D.C., so you have the opportunity to go to the White House, museums. I love the museums in Washington. I always go there at least once every month. And then, of course, you're close to Johns Hopkins Hospital. That is the #1 hospital in the world for the past 16 years. So what a great place to be. You can't be in any place better than Johns Hopkins. Then let me just end by, talking about some things. So Martin Luther King Jr. in 1964 said, an individual has not started living until he can rise above the narrow confines of his individualistic concerns to the broader concerns of humanity. You can go from here, from Johns Hopkins, and actually change the world. And that has been my own personal experience. And Michael Bloomberg, who the school is named after, said, we live in a global world with global health challenges. These global health challenges require global solutions. And no institution is better prepared to tackle them than Johns Hopkins School of Public Health. And then, of course, I have to talk about myself, too. So in 2009, I said something. I said the best leaders in the world should be in public health because millions of lives are at stake. And public health leadership is about making things happen and influencing people, programs, and policies to save life. And then our Dean Clark, said, we train leaders to change the world here at Johns Hopkins School of Public Health. These people live here and go out to make lasting impact in the world, wherever they may be. You can go from here and change your world. This is a great place to be. I don't have a single regret being here. This is the #1 school of public health. We have all kinds of things here. You can get all kinds of experiences here. And I want to congratulate you for applying and for getting admitted. This is very competitive. Getting into this school is very competitive, so you must be extremely smart to have gotten in. And this is a great place to be. I welcome you here, and I'm sure you have a lot of questions to ask, but you can change your world from here. You can make great impact here because this school will mold you. This school will help you to be a global public health leader who will save millions of lives at a time. Welcome, and thank you very much. So do you have any questions for me? You can ask anything. Maybe you can ask me about my personal experiences. I know I had only about 5 to 10 minutes to share, so that may not be enough time, but feel free to ask me any question. Thank you. Yes.
You said that you had 166 credits in your courses or whatever. How did you distill that to a more manageable, plate, I guess?
Okay, that was an excellent question. So I talked about, by the time I looked at all the courses and I made my selection, I had about 166 credits. I needed only 90 credits. Eventually, I took 94, which was too much for an MPH student, by the way. But I had to, it was tough, but I had to start talking to faculty. I had to start talking to older students. And then I went one by one. I chose the mandatory because there are some courses that are compulsory. You just have to do it. The ones that are electives, I had to go and read about the course outline, what is being taught in the course, the kind of way the exams are being conducted. And then I looked at past student evaluations. When you get admitted, you have access to the course plus, and you're going to see the same courses you want to select, what students in the past 3 years have said about the course faculty, about the course boarding, and so on. So for instance, if I look at a course and most of the students say, look, I don't like this course, this is not a good course, and they rank or they rated the course poorly, I don't choose that course. So, that helped me to, weed away some of the things I didn't want to do. And then there were some courses I really wanted to do. Now, let me say this quickly. You cannot manage what you cannot measure. So, when I came here, I made up my mind I was going to learn 2 important skills, measurement skills and management skills. And when I talk about measurement skills, I mean quantitative skills, the epidemiology, the biostatistics, and so on. And I needed also management skills because you cannot manage what you cannot measure. So I tried to select my courses to cover all the strong quantitative areas and also all the strong management areas as well. I hope I've been able to answer your questions.
And the risk science is public policy, right?
Yes.
Just a little ad for the good course.
One more question? Don't be shy. Okay, thank you.
What was the one experience or reason that caused you to learn that you needed a master's degree, and what was it that caused you to decide you needed a PhD?
What was the one reason that made me feel I needed a master's degree? I had an MD and I had an MSc. And why did I think I needed a PhD? Very interesting question. When I was working in Guyana, people used to, I tried to do my best, but I discovered I had deficiencies in quantitative skills and in management skills. I knew I was using common sense. Common sense is just not common, but I was using common sense to do things, doing the best I could do, and we were doing fairly well. Our program was actually nominated by the WHO as one of the 18 countries in the world to have reached our 3x5 WHO HIV targets. We were doing well, but I just felt I needed formal training in public health, especially in epidemiology, in biostatistics, and in management. And so I decided to come and do my master's in public health. And actually, I concentrated in health leadership and management for my MPH. It was while I was here and I was taking epidemiology and biostatistics courses that I discovered how deficient I was in AP and biostatistics. And I felt since I was on a scholarship, I got the summer scholarship, and they were potentially going to renew it for me for the second year. So I applied for the PhD in 2 departments. I was accepted in both departments, and I picked epidemiology. I got the summer scholarship, and if I have the scholarship, so I decided to stay back. So I got some jobs after my MPH, 3 jobs actually. But since I was being offered scholarship for 5 years with a stipend to stay back and do my PhD, I went for it. Thank you very much.
Thank you so much, Chuka. All right, we're going to move right along. Next up is our Bloomberg Seminar Series. You will see on your agenda we have 3 different room locations, and Mike Ward had also mentioned. One session will be in here with Dr. Terrett. There's going to be another session with Susan Sherman in Becton Dickinson Hall. That's right across the hall, that way. We will have staff out that'll help you direct as well. The last one, Judy Bass's, is in Anna Bacher room. The way to get there, just bear with me here. You want to go down the hallway till you hit a T, and then make a left. It's all the way down. Just look for signs for the Anna Bacher room. After those sessions, we will be back in here all together for a couple more sessions in a student panel, so enjoy the seminar series. Thank you.